Good morning, Dr. McKnight. How are you?
Good morning, Brad. I'm fine.
How's before we get started, I guess, on today, how's the class size and fill up for Fit for Life? Are we full yet?
Oh, yeah. We're, I think we've got over 30, and then we've got close to 20 that are just sort of listening in as one of the groups that didn't finish it last year. So we're probably a total of about 50.
Great.
And I think it's a good start for us with the virtual classes, so we'll see how it goes. First one's tonight.
I would think so, yeah. Well, you look prepared and ready today.
I'm excited. That's what I am.
Well, that's good. That's good. Hey, when the instructor is excited, that means some good things are going to come out. Usually.
No sleeping allowed. That's right.
Not during the conference, no. So speaking of no sleep, that's something that can happen to people who have something that's called restless leg syndrome. And I only became aware of that, I don't know, 4 or 5 years ago, maybe, but I feel like some of these things maybe have existed and we just weren't as aware before social media or didn't have a name for it. But what exactly is that?
Well, it's a neurological condition, and it's also considered a sleep disorder. But anytime you hear the word syndrome attached to a medical condition, that's sort of a clue that we probably don't understand the root cause of it. Strep throat, we know what that is. We treat it. This one, we know what the symptoms are. We know what people do, how they feel, but we don't have the clear-cut understanding of what causes it. There's many factors that may contribute to it or be associated with it, but the exact cause of it is really unknown.
So syndrome means we don't know. Sometimes.
I'm letting you in on a secret, but yeah, that means we don't have clear understanding of the condition.
What does that entail then? I mean, obviously your legs are restless, but in what sense?
Well, it can vary. It's and anybody can develop it. It tends to be women a little bit more than men, but it's a constellation of weird symptoms that people will describe: a pulling, an itching, a crawling, a pins and needles kind of pain. It's one of the hallmark features is that it's worse at night, and it tends to go away in the morning. If you have it at night and you get up and move around, that also tends to lessen the symptoms, make it more tolerable. So it's a restless feeling. Because the legs feel uncomfortable, you tend to move the legs to try to distract yourself. But that'll keep you awake for hours. So sleep deprivation is a consequence of this. But it's a weird feeling, and you'll see people wiggling their legs all the time. That doesn't necessarily mean they've got it. But if they do it at night and it's disruptive, then it's probably restless leg syndrome.
That almost sounds like a poison ivy of the inner leg, where it
is
irritating.
And that's why they have such a hard time describing it. But it's very extremely annoying. And so, we try, because we don't know what the root cause is, we have different treatment approaches, but some of them don't work. We have to keep trying until we find that one that works the best for an individual.
You said neurologically based, likely, so you're not really treating the leg when you do that.
Right, you're taking something systemically. And, I think eventually we're going to find that this is a toxic problem, some type of a toxic buildup in the body, or an organic acid, something that's happened to the body as a result of the environment that causes this for those who are maybe more genetically susceptible. I really think magnesium deficiency has a link to this, because I always recommend magnesium, especially at nighttime. And I know it really helps leg cramps, and I have had patients do better with just magnesium. But, if you talk to the experts, they'll say lifestyle changes, and it's kind of funny. We always come back to caffeine, tobacco, and alcohol as big contributors to a lot of conditions, but that's another example of what we want to try to avoid with restless leg syndrome, because that can make it worse. So when you say that those habits cause more problems, then you have to think, is this an inflammatory type of disorder or a toxic disorder? And so we have to. That's how I approach it, at least. So, in addition to the lifestyle issues that can improve it, sometimes they'll tell us to check an iron level. Sometimes iron deficiency will cause this, but I've rarely seen that. Sometimes we'll supplement with iron, but it often doesn't work. You can do have a massage in your legs if that's bothering you. You can you can put heat on it. Some people put ice on it. There's a vibrating pad that you can get. I mentioned the magnesium. So there's a whole host of sort of home remedies that you can try, and then we go to prescription medicines. But this is kind of like a migraine headache. Migraine headaches, we do the same approach where we'll different drug types, like, okay, this is strep throat, you need penicillin. Well, this is restless leg, we don't know what you need. Let's try these. So things like, we call them dopaminergic agonists that help you increase your dopamine levels. So that the common one is Requip or Mirapex, and that's for people that have severe restless legs. And then benzodiazepines like Valium and Ativan and Klonopin and Xanax, those work for a lot of people, but we really, really, really want to avoid those because they're extremely habit forming, and they might control the symptoms for a short time, but down the road you pay a price in so many other ways. And it's just a hassle for the patient and the provider to prescribe these long term. Narcotics, some people use narcotics, pain medicines, but that's another bad pathway that you really don't want to go down. The last category that probably most of us use are the anti-seizure medicines. Or again, like, why would you use an anti-seizure medicine? I don't know. Why do we use anti-seizure medicine for migraine headaches? Well, because sometimes they work.
Yeah.
So things like Tegretol, Neurontin, or Lyrica are the ones that we use. And that's, when I'm treating, those usually the ones that I would try first if these other things fail.
One other thing, you mentioned dopamine, and we've learned more about that with the stimulus with social media and that sort of thing. So is that a cause maybe of more symptoms because people are, I don't know, releasing more dopamine? Or
well, dopamine is a pleasure hormone. So if there's a lack of dopamine, you'll do whatever it takes to have that bump of dopamine. And sometimes you're using illicit drugs or other ways to try to artificially raise dopamine levels. So I think definitely there could be a link with stress and anxiety, and those, maybe, and less dopamine maybe causing that discomfort or contributing to it. So it's a good question. I'm not sure we really know because we've never really identified the chemical that's lacking or the chemical that's really causing the problem. But we're treating, and as you said, I think with social media, more people talking about it, it's probably more widespread, at least our the public's understanding or awareness of it. But it's been around for a long time. It's just now something that we've identified, and people will say, I read about this and I've got it, my friend's got it, and I think I've got it, and you're probably right. It's not that hard to diagnose.
Do you see many cases?
Yeah, I do. And, like I said, 10% of the population has it. So we do see it. And sometimes, often you see it in people that have other medical conditions and are taking other medications. And that's one of the points is things like antipsychotic medications can actually make it worse. Antihistamines, you take something for your allergies, that can make it worse. Antidepressants can make it worse. And so sometimes these people come in with multiple medications, and I'm not exaggerating. I've seen people with 15, 20 different medications, and you're trying to start to understand, why are they fatigued, and why do they have headaches, and why do they not move their bowels? And you look at this list, you're like, I don't even know where to start. But probably a third of those medications are not absolutely necessary. I mean, some of them you have to take, but some of them, maybe we can get you off of those, and let's clean this up and see what improves.
Yeah, your body might be better than you think.
These artificial molecules we put in our body doesn't know what to do with, and those are pharmaceuticals. It doesn't know what to do with these. And sometimes they'll have a systemic effect that alleviates a symptom or potentially what we think might improve a condition. But that's why I'm such an advocate of lifestyle changes and trying to reduce the medication load, because I really think that's how we're supposed to live and thrive. And once you start taking, it's almost like the tattoo thing. You get one tattoo, and before you know, you got another one, and then another one, and then you're full of tattoos. There's nothing wrong with that, but sometimes it's that mindset of, I got one pill, and now I'm used to that. And okay, once you get used to a couple medications, and what's the matter if I take a few more? I need them. I can't survive without them. And that's the message in mainstream medicine. I think it's so wrong. I've seen so many complications and bad outcomes with people on medications. One of the things I enjoy doing the most as a hospitalist is seeing patients from a nursing home come in with 20 medications, and I just start striking them out, like, we're not doing this, and this, and this. and they start waking up. They start communicating, and their dementia really isn't dementia, or at least not as bad as we thought it was. So we have to really be careful with overuse of medications. We call that polypharmacy. But I'm on a tangent here from restless legs. You hit a nerve with me. I'm pretty passionate about that. That's why we do Fit for Life.
Right.
But yeah, this is a chronic condition. It can be difficult, but I would always go back to lifestyle changes. Cut back your alcohol, tobacco, caffeine, exercise, try to get good sleep. I would supplement with magnesium, get those massages if you need, maybe even a chiropractic treatment. I'm just amazed at what chiropractics can do for nerve-related issues. And then if you're not having success and your sleep is impaired, come and see one of us and we'll try to help you.
There we go. All right, we appreciate that. Thanks a lot.
You're very welcome.
And I know you've been doing a lot more studying, and so next week we'll open up a new camp.
We've got all kinds of good topics.
That's great. Yeah. Hey, thanks a lot.
You're welcome.
That's Dr. Tim McKnight here. Talk with the Doc on our 8:30 High Beam this morning.